Hi guys, Happy New Year! It's 2021 and I'm so excited for this year. It's a very promising year. So one of my New Year's resolution is to first improve myself to become a better clinician, to provide a more beautiful and more functional. Everything's more. Syempre, I need and my team to up our level in dentistry, not just for us, but especially for all our patients. So this patient on her early 30s went to my clinic with a chief complaint of having this old restoration on her two front teeth. It's very obvious, very apparent that she wants it to be changed and fixed. But as we talk about the case, she also wanted to enhance the color and the length of her teeth. And I observed also that she has a very low lip line. And whenever she smiles, hindi siya nakikita yung upper teeth halos. And whenever the patient went into a repose position, there's almost no to 0.5 millimeter show of the central incisors, which is very not that good aesthetically. We can be able to enhance that because with women, you have to have at least like 2 to 4 millimeters show at repose. It's because of the anatomy and the formation of the lips, no, in relation to the teeth. So this is a 10-year-old composite restoration on the two teeth, no? So it's clearly discolored. As you can see, may konting recession ng gums, so we have to deal with it also. Every parafunctional bite or parafunctional contacts can damage the teeth. Sometimes these are the indication that we have to do something before it's too late. I've noticed that there's a lot of cavities, like especially class 3 composites, which very old and it has recurrent caries, so we have to remove all the unsound structure as will affect the condition and will worsen the problem of the tooth. So it's a little bit slanted. The canine, as you can see, medyo mas mataas yung isa sa kabilang side. So it's also not a good indication of a parang in a functional standpoint. So it has to be solved as well. She's actually afraid of the procedure na veneers. Baka it might look fake and something like that. It might not be an advantage sa part niya. So, we did a mock-up directly in the patient's mouth to be able to check the design na gusto niya. So I increased the height, I increased the thickness, I make sure that I balanced everything. We have a pattern that we can follow. So the design is subjective. It really depends on the totality of the face, the personality. The color may depends also on the color of the eyes, skin tone, and your preference as well. So when I open the teeth, I have noticed that there are big cavities on two front teeth. Super tagal na niya, ang daming recurrent caries, ang dami ko natanggal. So the preparation, it's kinda heavy on two front teeth. But the rest of the teeth are minimally invasive. I just remove yung facial area, and also may mga extension din for some part because we have to make sure that all unsound structure must be removed nga. Mga old restoration, tinanggal ko na din because we have to replace it with a better quality, which is yung ginagamit namin, a porcelain fused to zirconia core. So upon careful designing and a lot of work in the laboratory, like CAD/CAM design to the layering technique of the porcelain. Okay, so ito, the patient requested for a super white teeth, no? Actually, ang gusto niya, it's BL3. So we delivered BL3, but there are like few shades that would counter the opacity of the zirconia. So there are a lot of technique that you have to incorporate to be able to pull off the natural looking yet super white, timeless, and very durable and stable, beautiful ceramics. So here it is. We did a try-in of the ceramics. The patient loved it, and I think it glows because of that beautiful and wide smile. It looks very, very stunning, and it's really sophisticated. So it will or add value to her life. It's because of the confidence that the veneers is giving. Equilibration is one of the most important aspect in the success of the veneers. Veneers can last longer if you clean it, if you take good care of it, if you go to your dentist every 6 months. Studies, it can last like 20 years. It really depends. It really depends on how you take care of it, because the veneer is just a covering on the front teeth. So you still have a natural sound structure at the back. So you really have to take care of the totality of your mouth and teeth. So we were able to finish the case in just 7 days, in just 1 week. There was no issue like infection, root canal or something like that. So we were able to finish the case efficiently and fast. So we will be posting more videos for you to be able to relate sa case na to. So if you do have any questions or comments, just comment down below. Happy New Year!